Again, welcome to Nurse Aide tutorial. We left off at hand washing. Hand washing is the #1 defense in the chain of infection. It prevents from spreading diseases from one port to the next. Hand washing, according to your state test, must be done in 20 cycles hand over hand. Um, just start by saying the Pledge of Allegiance to yourself as a tip, and that will actually give you 20 cycles hand over hand. I tested it. Um, Make sure that the faucet is running with warm water, not cold water, because your examiner will test it. Make sure that you turn off the faucets with the towel, not with your hand, for you will flunk the exam right away, and there will be no turning back. Okay, with your hands, it's down for medication, up for surgical. Remember that. Okay, as far as to breathing, let me see. With apnea, apnea means not breathing. Tachypnea means breathing fast, greater than 40. Brady is slow, less than 10. Cheyenne-Stokes, apnea, and then over 10 to 60. So Cheyenne-Strokes mean, in other words, they're breathing and then they stop for a while and then they start back and they stop. Okay. Dyspnea is labor. Usually you find these patients that are sitting on the side of the bed trying to catch their breath because they're having such a hard time breathing. Blood pressure. The first strong beat that you hear, some people have a difficult time in catching this. The first beat that you hear, strong beat that you hear that said love, okay, loved up. The first one that you hear is your systolic pressure. The last strong beat that you hear is the diastolic pressure. One is the top number, the first one is the top number, the last one is your bottom number. For a normal adult, it's usually below 140. If it goes above 140, then you need to let the charge nurse know. The bottom number is between 80 and 89. If it goes above that, then you would need to tell your charge nurse for something could be going on. We have no idea. The temp for oral temp is 98.6. That's the perfect temp as it can get. Axillary temp, you add a number to it. So if it's 97.6, now it's 98.6. If it's a rectal temp and it's 99.6, you decrease that number. Okay. The respiratory, how you get it. Respiratory rates is you can time it by the whole minute, which you don't have to do any adding and subtracting. It's the whole minute, or 30 seconds times 2, or 15 seconds times 4. The positions that you will need to know is supine, which is on your back. That's with your palms face forward. Prone is frontward. That's with your palms face downward. And your face actually to the bed. Dorsal is on your side with one leg up. Lithotomy is patient is on the back with their legs in the stirrups. Fowler's is actually sitting up 90 degrees. Usually these patients can't breathe, and so they need to sit straight up. And Trendelenburg is actually with the patient laying down on their back and their feet up 45 degrees in the air. This is because maybe their blood pressure has fallen and they need the blood to rush back to their brain. Okay. I want to go over proper lifting techniques with you. Again, on your test, proper lifting techniques can only be used by your legs. It cannot be used by your back. Your back is actually what makes your money. So it is your legs, your knees, your legs, never your back. When performing range of motion tests, if you pick this skill, range of motion tests, you must stretch out the extremity all the way as far as the patient can go. It is very, very essential that you ask the patient, are they okay? Does this hurt? Is this comfortable for them? That is a communication skill. And it shows the examiner that you're concerned about the patient. So stretch it out. Make sure that you're actually working every joint. Another one is lavatory. Excuse me. The first one, the gray tube, when you actually are subject to pull blood or to go get a blood specimen from a patient. The gray tube is for glucose. Light blue is for coagulant studies. The lav is for CBP. I'm so sorry. Is CBC, complete blood count. Green is for plasma. Tiger is for serum. Brown is for lead. Black is for ammonia. Royal blue is for plasma. Yellow gray is for serum. Red is for serum, and also you can use as extra. And yellow is for cultures, blood cultures. I hope this information was good for you as it was for me. Good luck on your test. Hope that you make it. And hope to see you out there.